on Wednesdays, we do health on the ENL segment of the show. This morning, we're talking about hernia epidemiology in Ghana. We take a look at surgical and for people living with hernia. I have here with me Dr. Prince Kwame Darko. He is the Managing Director for HumeServe Foundation. And then, of course, George Kwame Ega, Head of Operations, HumeServe Foundation. Good morning to you. Good to have you here.
Yeah, good morning, Liberty.
I hope you're doing well.
Yeah, I'm great. So.
Right. There's this notion that footballers suffer hernia the most. Is that true?
Statistically, it's not true, although you do find it in footballers. The thing is that hernia, one of the risk factors is anything that causes you to strain, all right, or anything that increases the pressure in the abdomen. So maybe constipation, maybe chronic cough, maybe lifting weights, maybe anything at all that causes you to, increase your abdominal pressures. And footballers, they do a lot of, when you are kicking, you in a way you use your abdominal muscles, so it causes you to sprain. So yes, you do find it in footballers.
Right, Prince, right?
Yeah, Prince.
Okay, so kindly take us through this. What is hernia? Give us some education on it.
Okay, so before I start, I forgot to say good morning to your cherished viewers. And thanks for giving us a platform and opportunity to talk about, firstly, our foundation, HumeServe Foundation, and then hernia. Mr. Ege will talk about the foundation in detail, so I'll just focus on the hernia, since that's my specialty. So in brief, hernia is just an outpouching from a confinement. Okay, so imagine the body. It's divided into various compartments. So we have the chest, we have the abdomen, we have the head. All these are confinements. So if you have a weakness anywhere, and then there's a risk factor that increases any pressure from the inside, you can have a hernia. And actually, I brought something to demonstrate.
I see.
It's a schematic. It may be a bit oversimplified, but I think it will be comprehensible to our viewers, okay? So let's imagine this is the torso of Mr. Ege, all right? I'm going to make this his legs. So for the purpose of this discussion, we're going to focus on just the abdominal hernias. There are so many kinds of hernias. You have the internal hernias, that's the one you don't see. You have the external hernias, those are the ones you see. And we have hernias in the brain, hernias in the abdomen. We're going to talk about abdominal hernias, the external ones. So assuming these are his legs, I'm sure you've all seen this kind of hernia before. So hernia is caused by a baseline defect in the abdominal cavity, in the abdominal wall. Okay, so I'm going to make a defect here, which is his umbilicus. I'm sure you've seen this kind of hernia before, the umbilical one, where there's a protrusion from the umbilicus.
Exactly.
That's the type of hernia called umbilical hernia. Okay, so if you have a baseline defect, then you have any risk factor that causes you to strain. For example, if you have urinary issues, you need to strain. If you have constipation, you need to strain. If you are coughing excessively, you need to strain. If you are lifting weights, you need to strain. If you are in any profession that causes you to push or pull, you need to strain. Vis-a-vis our fishermen, it's very endemic in them. Yeah. So this is our defect, and what do you see? It's protruded. So this is the umbilical type. And then we have the inguinal type, which is also quite common, where there's a defect in the groin, okay? And when this happens, we have intestinal contents, or your intestines, passing through this defect into your scrotum, and that's the inguinal type. So yeah, this is a schematic presentation or demonstration of a hernia.
I see. Does it affect women as well?
Yes, it affects people of all sex and race and age. Although because of the risk factors, that is anything that increases your intra-abdominal pressure, it's more common in men than women. But yes, you do find hernias in women as well.
Right, let me come to you, George. Do you have any idea on data concerning hernia in Ghana?
Yeah, when we started work on hernia intervention, it was basically my responsibility to look at, because we're looking at a national program.
Exactly.
So we needed to obtain a national data on it. And in my search, I think I came across the Ghana Hernia Society. And they had been working on hernia for some time. They started in 2003, and then they've been around. And in 2017, they came out with a data, which I'm going to actually read out here. They say is that it is estimated that in Ghana, over 10% of adult men 18 years and above have inguinal hernia.
Okay.
And nearly 800,000 Ghanaians have inguinal hernia, and about 530,082 of these are symptomatic. And then every year, an additional of 53,008 incidents of inguinal hernia occurs in Ghanaians. So in total, you have, at the current estimated hernia repair, at 30 per 100,000. So that means that in every 100,000, you have only 30 people who are actually going for hernia repairs. And there are a lot of reasons why, which I'm sure we would talk about. So they said in 10 years, we'll have 1 million hernias needing repair in Ghana in the next 10 years. So, and this is a statistic on ground as at 2017. So when we started earlier this year, we have been trying to work with the Municipal Health Directorates to gather new data on the subject matter.
So let's talk about your responsibilities as the head of operations.
Okay, so basically, I'm in charge of the administrative protocols of the foundation, and I'm also in charge of operations. So my job as doing both would be, first of all, to get in collaborations for our interventions. And so you see me trying to work out partnership with institutions. One I have mentioned, like the Ghana Hernia Society. Currently, we're about to synchronize our activities so that we can have a national hernia program tied to the Operation Fix Hernia. So it is also my responsibility to work with the Municipal Health Director to gather data. And then apart from this too, I have to also reach out to people on a general scale. So I get calls every day from people who have the challenge. Even when I walked here this morning, I got a call from someone who is having the challenge. So all this put together. So I'm also in charge of ensuring that our strategies are in line with our vision and mission.
Exactly.
Yeah, so those are basically, in a nutshell, my responsibilities.
I wanted to ask, what is your vision and mission then?
Okay, so our vision is to become an institution that provides a nationwide medical intervention for people who have different kinds of medical conditions. And when you talk about that, it also includes hernia is a minor surgery, so we're also looking at specialized surgeries.
It's a minor surgery.
Yes.
I see. Let's talk about that. How is the repair being done? How is it like?
Okay, so the repair, to start with, will depend on the type. For the purpose of this discussion, I'm going to just focus on the inguinal type.
Right, let me quickly do this. Now, there will be some pictures and videos that we will be showing. Please, viewer discretion is advised. Kindly go on with
this. Yeah, so I'm just going to focus on just the inguinal type.
That's the one that comes in between the legs of the men. Yeah,
that can enter the scrotum and make it big and enlarged. Yes. So now the repair is quite simple these days. It can be done as a day surgery actually, whereby you come
just like the one on the screen.
Yes, as you can see, that's a huge inguinoscrotal hernia, as you can see over there. Yeah. So based on the severity and the type, it can be done as a day surgery, whereby you come, you get assessed, and it's done either under local anesthesia, where the surgeon just injects that area, so you don't feel the pain. So you'll be interacting with the surgeon while this is going on, or it can be done as a spinal anesthesia, where you are injected at your back, and you don't feel the pain from your navel downwards. And afterwards, you can go home that same day. So yeah, in a way, it's a minor procedure.
Right. Does it affect this picture that we saw?
Yes.
Does it affect children too?
Yes, as I said earlier, it affects. Yes, as I said earlier, it affects people of all ages, sex, race.
I see.
Yeah.
So let's talk about the women. I mean, we don't see this often.
Actually, you do. You'll be surprised. You do. In women, for instance, we have a type called femoral hernia. I don't want to make things complicated, but it's also in the groin region, which is even more, and that type is actually more severe because it can get, when your intestines kind of seep in there, because of the tight area, it can get blocked and cause severe complications. So you have that type, that are the femoral hernia, which do occur in women. Although in general, the inguinal type is more in both sexes, but then you have the femoral type more in women than in men in general.
Right. So there are beliefs admit that men who undergo surgery to repair hernia can no longer be sexually active. How true is this?
Yeah, very interesting question, and I would like to use this opportunity to debunk some of these myths, because studies have actually shown that some of these myths do deter people from seeking surgical intervention. So no, hernia repair does not cause you to be impotent, or it does not affect one's sexual health or one's sexual life. Why do I say so? So the area we operate in basically involves the sac from your abdomen that's protruded into your scrotum. You know, can I? Okay, let me. So we have the private parts, and then we have the scrotum. They are two different things. They work independently of each other. Okay, so for the hernia, the sac protrudes from your abdomen into the scrotum. And when you are repairing, we only focus on that part. The penis is not touched whatsoever. Okay, and let me use another opportunity to also debunk another myth, which is you can.
So let's look at the one on the screen.
Yeah. So this looks like a huge left inguinal hernia. So.
Is that his manhood that has shrunk in?
Yeah, it's so huge it has engulfed his manhood. Yeah, you do have cases like that. So all that you see there is abdominal contents, that's the intestines, all seeping down into his scrotum. Yes.
But I believe before we get to this stage, there are some symptoms that shows.
Yes.
What are some of the symptoms?
Okay, the obvious symptom will be periodic gnawing pain.
Explain that for me.
So you feel as if something is pulling your intestines in a way. Do you understand? Yeah, that's one of the symptoms. Although sometimes it may even be asymptomatic, where you don't even feel any symptom at all. All you see is a huge bulge in your groin area, and this swelling may increase when you cough or when you spring. For example, when you are lifting weights, you may see it getting bigger. When you cough, you may see it getting bigger. So when you go to the washroom and you're using the loo, it may get bigger. So these are some of the symptoms. Worst case scenario, they can get entrapped in that sac, and you have excruciating pain, vomiting, mouth fever, all that.
Right. Is the symptoms the same for women as well?
Yeah, they're the same for women, since the mechanism is probably the same. Yeah.
Okay. What of the children?
Yes. So for children, let me divert a bit. Although they have hernia, they also have another condition called hydrocele, where there's literally a fluid. Instead of there being protrusion of abdominal contents into the scrotum, you have fluid collection around the testes. But they all have the baseline genetic defect in both. So it's just a baseline abdominal defect that causes these. But yeah, you do have it in children, where they can either present with the hernias.
Well, I'm interested in their symptoms, because kids don't really talk that much. What are some of the things they do that would tell a parent to know that, look, probably it's hernia that is beginning to set in?
Very good. So until the hernia is complicated, that is, until it's strangulated, which is when it turns on itself, or it loses blood supply, or it's trapped in that ring. Mind you, it's just a small hole. Yeah. And just imagine your intestines passing through it. So they can't get blocked. So unless you have these complications, you never actually have any symptoms. But you as a parent, you have to observe and see that, no, your scrotum is bigger than usual. Or maybe one side is bigger than usual. So these are some of the telltale signs of someone having.
Right. George, let's talk about the foundation. Okay. How long have you been in existence?
All right. We started our operations basically in March this year. And then we've been operating since March this year. And even though we have a lot of surgical interventions, we saw this area as a neglected surgical condition, meaning that it's one area that people do not really take seriously.
Exactly.
Yes.
Yeah.
You have situations where people have it and then they don't take it. So I have a list of
they
cases.
They walk around.
Since it has not really like kept them on the bed, it has not brought you down to your knees. They don't really care. They walk around.
So there are stages where it brings you down to your knees.
It doesn't grow up like this. It takes.
But I've seen people walk around with it like it's nothing.
Yeah, so let me just chip in. As I said earlier, until it gets complicated, as intense on itself and gets obstructed, you know, your only burden will be the overwhelming weight of your scrotum, so to speak. And some people maneuver over it, they can go to work with it. But in a way, it can affect your livelihood. Just imagine that you're a fisherman and you have this big hernia in you. It can limit you in a way because the more you strain, the bigger it gets, and it can get painful. So yeah, some people maneuver over it, they can go about their daily business, depending on the size. So yes, so that's how come you see people walking around with it.
Right, George.
Yes. So we have a number of interventions. Like I said, we only focused on hernia because it's a neglected surgical condition. It's an area people are neglecting so much, and it can actually kill. I'm sure Doctor would go into the details of that. So we thought that we should focus on this more. But however, we have other things that we do as a foundation. We are also supporting people who sometimes, I used to work in a hospital, and there were times people walk in and then they've been treated, but they don't have the full amount of money to pay.
Right.
So we sometimes have to investigate to make sure that the person truly is telling the truth.
Right.
And then we can go into a kind of talk with the hospital and then see how we can pay off the money.
Okay.
So that way people are not remanded in hospitals and then you'll be forced to live in the hospital and not allowed to go.
Right. I believe you faced some challenges along the way.
Yes.
What has been your major challenge?
I think the major challenge is basically the usual one, the funding aspect of it. As a foundation, we have done everything possible to work around it because, of course, it's the key challenge. You need funding to be able to do a lot of things and all that. So there's been personal contributions from even the team members. There've been donations from well-meaning Ghanaians who are there. They don't want to be mentioned to support our activities. So basically, that's the key challenge. But somehow we get by.
We are making strides.
I mean, if you look at the surgery we did on Saturday, there's an elderly man.
As for the surgery, I don't even want us to because the moment you talk about
it's a minor surgery.
It's minor.
It's not heart surgery.
I think the point I'm trying to make is the elderly man who walked in and came to say thank you.
Yeah.
He was so compassionate.
But I've seen a man cry after the surgery.
I think it may probably be due to the excruciating pain, which is expected after surgery.
Right. On this note, let's take a quick break here.